My name's Josh Ehrlich, and I'm one of the second-year residents here at Wills. And along with Drs. Feldman and Hanush, we looked at sort of the way WIRE fits into the overall framework of ophthalmology residency education. And of course, residency education in ophthalmology and other specialties is defined by the American College of Graduate Medical Education. And in ophthalmology, we have, and I imagine other specialties also, 6 areas that are defined as core competencies, in which various residency experiences are supposed to play a role. And so our question was whether or not WIRE is playing a role to fulfill any or perhaps all of these core competencies. So we missed something there. Oh. To this end, we've surveyed each resident that's come back from WIRE, and up to this date, we've received survey responses from 12 residents that have gone on WIRE, either to Kenya, to Dominican Republic, or other locations. And resoundingly, every resident that was surveyed, and all the questions were targeted to each of the 6 core competencies, have provided good evidence and compelling responses to show that all 6 core competencies are actually covered in the WIRE experience for every resident. The residents cited several key benefits that fit into certain of these core competencies, including diverse surgical experiences. You've heard from Ali, Dave, and Terry. As a median number of M6 out of these first 12 residents to complete the WIRE experience, 11 of these small incision cataract surgeries per resident, ranging from 2 up to about 16, as well as a host of other surgeries that you've heard about in greater detail from others. People also consistently cite exposure to distinct healthcare systems as a true benefit of the WIRE experience, something we don't necessarily get here, although we see a diverse array of patients. We're sort of functioning in one healthcare system here. And then really learning to provide high-quality care with limited resources, as again, Ali, Dave, and Terry have gone over, is purported to be one of the great benefits of the WIRE experience. And if I can just go back for a second to look over the 6 core competencies, we can see that a lot of the things that were highlighted as the key benefits of the WIRE experience by the people that have returned really do fit into these 6 categories. And then again, those more targeted questions that we asked, looking at each of these core competencies, it looks like the experience really is really adds a lot to residency education, not only as you've heard already today from residents that have recently returned, but also in a more academic sense, fulfilling those things that were required to fulfill as residents. So.
The folks at the tables here are the individuals who have really put a lot of effort into making the WIRE possible in global ophthalmology at Wills. And they're also some of the leaders of different departments. We have a program director. So I would like to hear now from the panels about what they see as the value of WIRE and why you feel that this is an important component to Wills education. What it adds that the residents can't get here at Wills, and why we think, what's the compelling argument for it. And Dr. Payton, you're welcome as well to make comments here. We'd appreciate hearing from you. So anyone would like to start? Maybe I could start with Tara, since she is our program director. We can now move to the table for.
Dr. Howard was talking. I was like right there. Thanks. Honestly, I think one of the probably most important things for WIRE, I obviously defer to faculty who've gone on trips and to the residents who are returning from trips, but I think it's really just to give exposure as the most important thing. I think that at this point in time, as so many people alluded to, we can help with service a little bit, but it's really, I think, to assist. And I think, as Dr. Sauls put on his first slide about the points, his goal was to assist, and not that he's actually thinking he's going to make a huge difference while he's there, very, very important, but while he's in training, they're going for such a short snippet. A lot of times the programs that are being so gracious and the faculty on the ground are being so gracious hosting our residents, we really slow them down a little bit, to be honest. And I think this is just really a foundational program for the residents to get a taste of it, to be supported, and then as every single resident has mentioned, that it's going to be part of their future. And I think that's the key. And I thought that Dr. Kleinberg's comments about it's never too early to start and involving your family as well. And it kind of full circle, Saul started his with his family. And I think the more people that part of that extended family, it works. And I think going with faculty members is huge. I also think that we're incredibly fortunate. Again, huge shout out to Dr. Roberts. Can't thank you enough. I wish we had a Dr. Roberts everywhere, or at least a Dr. Bedrosian who's going with them to the places where we don't.
One of the reasons that I think it's so important to have a WIRE program is that here at Wills, we're so fortunate to have everything we need at our fingertips. We have the latest of technology, we have the latest of medicine, and we learn how to operate using certain instruments and certain equipment. The test of really true surgeon is one who can operate and do what they need to do with equipment that they may not be used to being trained with. And when you go to a program like this, we often have to do what we need to do with equipment that we're not used to working with. And I think that for a resident in training, it helps that person understand that there's more than one way to do a certain procedure, and you do what you have to do to get the job done. And then when we come back to Wills, we realize how lucky we are to be here.
I'd just like to add a little bit to that, and that coming out of Wills is like coming out of a womb. Whenever you had a patient, you didn't know what it was, you just took it to that specialist and they told you what it was and what to do. When you're over, say in Africa, you may be the best trained person around in that area, even as a resident, and it really makes you think. And I remember when I was there doing incredible trachoma cases where the lid was folded in multiple times, and I was doing it with the Academy plastic surgery book right by my side as I did it. So it really forces you to think and consider all the information you have at hand. And that's a skill that you may not have at Wills when everything is so easy.
I would also like to second Dr. Guler's comment and say that the habits you learn during residency and medical school are the ones that lay the foundation for the rest of your life. And as someone who did the WIRE program and now is out in practice for 2 years and getting my feet under me, it's easy to kind of have tunnel view and just go straight forward with practice in the States. And I think that having had the experience to go abroad during medical school and here at Wills is something that will help me to be able to do that early in my career and help with global ophthalmology in the future, rather than when I get more established in my career and think, oh, what else would I like to do? I'll do this. Can start doing it from the get-go.
I think we're extremely fortunate at Wills by the breadth of pathology that we see here, and we see it in a very well-off community. I think it's one thing that makes me really proud to be part of the Wills family is the commitment of our administration to taking care of every child, in my case in Philadelphia, regardless their social status, their economics, and we see some pretty poor kids in some pretty adverse circumstances. But what's going on outside there in the real world, we really only see a fraction of the kind of pathology that's blinding the world and the kind of poverty that's affecting the world. 35,000 people every day die in the world from hunger and hunger-related illnesses. 35,000 people a day. So we are really insulated from that, and I think getting the residents out to see the real poverty, the real way the world lives, can only stimulate you to continue to make the world a better place, and I think all of us can benefit from that. I think the other advantage of WIRE is, as you were mentioning, we become the teachers. The residents become teachers. And all of a sudden, your own expertise, the benefits you get from being a resident at Wills, which are outstanding, you're now at the top of the class. And you're teaching residents and sometimes attendings that have a lesser level of knowledge than you have from being in such a wonderful place as Wills. Learning to be a teacher is a skill and it's something you can develop in your own, and this is a great opportunity to do that. So many benefits from this program.
I would like...
I don't know if I can interject here or not. Maybe you can let me know if I should talk or not. But yeah, I would agree that the teaching is definitely both ways. It's been an incredible pleasure to have the Wills residents come serve for a couple of weeks here at Tenwick Hospital, and my staff love it. So I have a staff of maybe 15 people, and they love getting to know these new doctors, and it only helps our care of patients because they bring knowledge and experiences that many of my staff don't have here. So the teaching goes both ways. So.
As an attending who went to Kenwick and spent a week with Ben, I didn't know what to expect. And Sudhir had kind of told me a lot of what to expect, but I didn't kind of know what I'd get out of it. And from residents, it really broadens things. But even as an attending, I just learned to think, as I think Rick or Ned was saying, think out of the box. And, you then become, to watch Ben see, I don't know, it was a neuro-ophthalmology problem that came in. Both of us are, you scratch our head saying, well, what do we do with this? We got to look it up and go on the internet and try and figure it out. So to think that, I'm in my special little box, neuro-opt, I don't even have to think about it here at Wills. I just send it down the hall. But as intending to go and, come up with solutions, and in the OR, here I use, 50 WEC cells, and any graft I do there, it was 3. That was your allotment, 3 WEC cells, 1 double-arm suture, that was it. So I had to do things somewhat differently and think differently about how I did everything. So it really was it was an amazing experience just for my own kind of medical surgical growth, but just to spend time with Ben was also incredible. So thank you.
I would be lucky with those 3 WEC cells. So I was there, we had no WEC cells, no intraocular fluids, and no gloves. I would like to ask our speakers whether there's a place for medical students in this program.
Where we are, or the programs I've been involved with in the Dominican Republic through VHP, a lot of family members come, and the family members can be all different levels of training, and we try to put people in a particular facet of that screening that they're skilled or able to do. So medical students would have a place, I think, in most of these programs to be able to do what they can do at their level, and plus it'd be a tremendous experience for them as well.
I would add,
Yes.
I think every single person in this room, regardless of whether you're a medical student, a resident, a fellow, an attending, a nurse, an ophthalmic technician, anyone can be of value to these programs. Anyone who works in this building has, by definition, an experience would be useful in these places around the world. And I would encourage everyone to get involved.
Yeah, here at Tenwood Hospital, we do have medical students to come. In fact, that's what first introduced me to this opportunity here at Tenwood Hospital. When I was a senior medical student, I came and spent 2 months here on an elective rotation. And quite often we have those medical students that come, and I've had some that have come and spent time in the eye department, and they've been a tremendous help, and of course it really opens their eyes before they begin residency as well. So there is a place for medical students for sure. I'd say also Dr. Rob Brano's son came and spent about 3 months with us, and he was just graduated from university, but was a tremendous help us to further develop our electronic medical record program, and did so many things that helped us become more efficient as an eye unit. So people in all facets are very valuable.
And since Dr. Payton's here, for those of you who don't know, the Orbis program, in addition to having the medical component where ophthalmologists train ophthalmologists, has a anesthesia training program, so anesthesiologists can go out there, has a biomedical training program that's on the plane all the time, has a nursing training program. So there's multiple. We do what we do every day because of all the people around us, from administrators to paramedical professionals. Everyone helps us give care to the patient, and therefore everyone needs training, and it's very, very useful to be all inclusive.
And I think this question is a nice segue into the next thing that I wanted to talk about, which is what can Wills do more globally, and what are we doing? And I think there's a lot of people at Wills who are working abroad or working doing community outreach, and we're not all aware of what the person next to us is doing. So I'm going to ask Sudhir to come on up, and he's going to present just a small segment of what some of the Wills faculty have been doing, and then we can talk more about what should Wills be doing as an institute or as a hospital to better leverage its skills and its faculty?
So I'm Sadir Hanish from the Cornea Service, and I can't tell you how excited I am to be here today and to summarize for you in a couple of minutes what has happened over a decade. And the decade has to be divided into two segments, what I call BH and AH. That's before Haller and after Haller. So BH, we interview John Cropsey on December 5th, 2004. In his interview, he has the audacity to express an interest in mission work. We meet on Tuesday evening when I was serving on the resident selection committee, and many of you who were serving on the resident selection committee are here tonight. And there was a little bit of a discourse. Not everybody agreed that we should be training someone who will be spending his career outside the United States. Bill Tasman argued for inviting John to be part of our residency program. Thank you, Dr. Tasman. The rest is obviously history. John graduated in 2009, went to Tenwick, and had this crazy idea of having me go there and start a corneal transplant program over there. And I'm going to kind of dovetail this into what David Payton is going to talk about shortly, I think. So the idea of us going there in a place where Ben Roberts was already providing sophisticated eye care was what I thought at the time was not only to offer services, which many of us have done over the years, but to also not just give them the fish, but teach them how to fish. And this was my dream. And for the wire program works beautifully, but what all of you have to understand, it has different segments to it and different models to it. With Tenwick, there's already sophisticated ophthalmology by world standards being provided there. So unlike what for example, Ned was doing in the Dominican Republic, where he is training the wire resident, at Tenwick, it didn't work very well for an attending to go with a resident. Instead, the resident was there to learn from Ben Roberts, and the attendings were going there to teach a skill that was not yet being offered at Tenwick. So I would like to take this opportunity to plead with you, faculty, to consider going to these places to train the locals to provide care, meaning so that, and I think that's something that Dr. Payton will be talking about, meaning how to teach ophthalmology globally. So to move forward in the after Haller era, I want to say that this dream that I had could not have happened without the support of our ophthalmologist-in-chief, Julia Haller, and our executive director, Joe Bilson, and tremendous energy from Brad Feldman. Brad, you made my dream come true. I could not have done it myself. I mean, he has organized and cajoled and begged, and obviously he has a much nicer personality than mine, so people listen to him more. And I think this is something fantastic that's happening. So as we move forward, I envision academic global ophthalmology, which we'll be hearing about from Dr. Payton. All of us know the Payton name for years. For those of us in cornea, as you know, we have a society, a sub-society called the Payton Society after Dad, our Townley Payton, and which is a very important name in cornea. But I think going into the future, it's not enough for Wills to simply give our residents opportunities to learn things abroad, but also for our faculty to transfer knowledge in a transformative way to other countries in the world where the locals over there, be they long-term commitments like Ben Roberts's is, or actual people who are from these countries, then learn these skills and transfer them to their residents and fellows. Now, that being said, I just want to say that, okay, so the slide is up here. So many departments at Wills have surgeons who have contributed to global ophthalmology. And you can read, the pediatric service, the cornea service, the glaucoma service, the oculoplastic service. All of us are doing things across the planet. And I know, for example, Bruce Schnall has not been mentioned yet tonight. Bruce has done tremendous work for years. So this is not only about wire and the cornea service, but what I'd like to see happen is these faculty train the locals over there to then provide care. And I hope that my thoughts are aligned with yours, David, whether we do it remotely or on the ground. But I think we need to encourage our faculty to be engaged. Thank you, Brad. You want to take questions? Okay. Okay. So, Brad, do you want me to?
Just wanted to mention that for people who aren't aware, there's a lot of international observers and fellowships here, and this is not even including the probably 20 people you can find on Dr. Shield's service at any time from abroad. But there's a lot of international folks who come here to learn, and this is something that we as a hospital should be very proud of, that we're helping to develop the next generation of ophthalmologists around the world. And we have our faculty teaching all over the world already at supranational conferences year after year. And this is a big part of global ophthalmology and academic global ophthalmology here at Wills.
And also, all of you are now familiar with the Wills Knowledge Portal that Julia has championed. And for those of you who ever log on the portal, you know how much wealth of information is on the portal. Of course, I think, Ben, you will need some serious bandwidth to be able to log on and to listen to these talks if you want to make them available to your residents. Jack Scully is assuring us that this will soon be available with less bandwidth so that you can all log on and hear our incredible talks. So thank you, Jack, as well for making this possible.
And one other big part of academic global ophthalmology is what we do here locally, which we haven't mentioned, but Dr. Levin and the Give Kids Sight Day and the Wills on Wheels and all the programs that we're doing here locally, we put a lot of resources into that, and we should be equally proud in presenting these things as well. That's all part of what we're doing to reach underserved communities. So, Ben, I was wondering if maybe Ben Roberts wanted to share some of his thoughts about ways that our faculty could be of particular help to him in the future.
Yeah, as Dr. Hanish said, he said it very well. His idea of coming over here and teaching a skill, not just coming to do a few corneal transplants, but teaching a skill has made a tremendous impact here at Tenwick, just as an example. So he came for the first time in March of 2010. I think brought about 25 corneas, and Dr. Cropsey and myself were here, and it had been several years since I had done corneal transplants, and Dr. Cropsey was not too far out of residency, but he helped us to get that program started. And I think to date, since 2010, we've done about 300 transplant surgeries here in this facility. I'm not a cornea specialist, I'm far from it, but he enabled me and others to have the skills that we needed to provide that service here. So that's an incredible use of your talents. You're all you're in the top of your fields, and to be able to come here or anywhere in the world and to help transfer your skills, even if you're only there for a week or two, and make a tremendous impact in the ongoing eye care around the world.
Ben, what are your needs currently, if you had a wish list of who you wanted to come?
I think, I don't know if it was Dr. Khan or, but mentioned, probably plastics and pediatrics. I've had some pediatric visitors come. When I know they're coming, I'll stop doing the pediatric cases about 6 months before they get there, save them up for them. But those are probably the two biggest needs. But again, any subspecialist is welcome, and we learn from any area as well.
Dr. Shields wanted to say something.
Yeah, just another comment. This is a wonderful program, and I think you're doing great things. I bet very few people in the audience know that this is not new at Wills. When I was a resident and fellow, established by Robinson Harley, was the efforts we did with the Project Hope. And we started for 2 or 3 years. We had people coming from the Wills residents constantly going to Brazil and other areas where the Hope ship was. And I spent 4 months there myself with training the fellows, and my 2 fellows happened to be George Waring and Lou Schwartz, each for 2 months during the 4 months I was there. So we did some wonderful things in Brazil, working in the interior, going to their villages, working in leprosariums, treating lepers with surgery and so forth. So just for your information, it's not entirely new. It happened years ago and then is now being revised in a wonderful way.
Actually,
Yeah, I'd like to just applaud Wills for your willingness to have such a program. I've tried to get such a relationship with other programs in the States, other residency programs, and sometimes there's a fear that if we send our residents out of the country, we're going to have a reputation that they have to go out of the country to get their numbers or to get their surgical experience. And as you know, that's not true with Wills or most of the accredited programs in the States. So it only adds to your training as a resident, but it's not anything that's required to graduate with good skills.
I just wanted to comment on what Jerry was saying. Actually, my first mission trip was when I was in college. I went for 3 months down to Brazil, and that's where I first met Jerry Shields. And so this program has been going on for a long time, and it's nice to see it finally formalized. So it really, to ditto what Terry said, was it's never too young to start.
Okay, one last comment, and then we'll bring on Dr. Payton.
I would just like to say something to the younger people here. Reed Kinderman in the back taught me that life is not a dress rehearsal. You don't get a chance to go back and pick up on the opportunities that you missed as you went through. And what you want to do is begin with the end in mind, so that when you're sitting on your old age home porch, rocking back and forth in your chair, and you can't remember what you did yesterday, but all the major experiences from your past you can remember, you don't want to be sitting there thinking about all the barbecues you did on your back porch or whether you visited your cousin in Baltimore. What you want to be thinking about is the incredible experiences you had in very memorable places with unforgettable people, and that's what these kind of opportunities give you.
I had a quick comment. Ben, this is Julia Haller. I'm interested in another aspect of this, which is what can we do in terms of research protocols? The interesting study comparing the small incision surgery to phaco would be an example of this. And also in maybe phase 1, phase 2 testing of things that wouldn't be available anywhere, but could maybe be tested in a place like Africa ethically, and using the resources of Wills and of your facility, and maybe in Burundi of John Cropsey's for being a resource for testing new types of treatments and equipment and therapies. Because it seems to me that would be an academic way to take this program in a slightly different direction. And really, quite frankly, we were thinking when we nominated John for this Artemis Award, maybe that was a way to get him high-profile exposure. So now we can start introducing him to the presidents of some of the companies and things, and he'll be up there in black tie. I know he's embarrassed about it, but he's going to be up there in black tie at the Academy, and people will know who he is.
Yes, yeah, I think this is a great environment to do studies, and we've done that on a very small level, just out of personal interest. But as Dr. Khan mentioned, Tenwek is a full hospital, not just an eye hospital, and there's a lot of other colleagues, general surgeons, that, in particular, that have done a lot of research here at Tenwick and have had the backing and funding from institutions and other places in the United States. So, yeah, again, as you said, we in doing research anywhere in the world, you want to do it in an ethical manner, that you're treating the patients fairly, but we don't have as many restrictions as you might have in the States, and we also have a lot of pathology and a lot of opportunities to do research in this area.
Just to make one comment about that, one study which was done in Africa was done by Sharon Eisenberg, using 2.5% betadine as an ocular prophylaxis, and it was very effective and found to be very cost effective, and I'm sure is making a example of global ophthalmology, one to make the prevent blindness in children.
Great. Are we good? Great. Well, thank you to all our panelists and discussants and residents. Really an inspirational session, and I think it points the way towards a lot of exciting things for us.